The tyranny of distance places additional strain on primary healthcare services and on the people who are in very vulnerable situations. Patients in rural areas face isolation with fewer and infrequent services, compounding health issues for those with chronic illness. What they and the healthcare system want is to stay at home and avoid primary care as much as possible. iCCnet has packaged easy-to-use monitoring, analysis and communication technology, making it possible for people to self-monitor and gain immediate test results at point of care locally, transforming their own home into a highly effective front line of health management, and the GP into a highly efficient place for diagnosis and treatment. For country practices, this has delivered measurable benefits. Dr. Ken Wanguhu, a GP from Waikerie, was an early adopter and relates one example: an elderly lady who uses the equipment by herself.
And since we said the home monitoring, we've not needed to admit her to hospital, and I think that's a big plus.
The doctor can know immediately if there's any change in my condition.
She's got multiple system disease, kidney, lung, heart, and that has helped her stay at home, and so it's a great thing.
Nurse manager Judy Sparrow reflects on direct patient feedback.
There's another guy with poorly controlled diabetes, and he came in to see me for his annual checkup, and I said, would you like to bring the kit in because it's been nearly time? And he said, no, can I keep it longer? Because he said, I know if I do the wrong thing, somebody's going to call me and find out what's happening.
The cost benefit to the healthcare system is significant. By providing people with easy-to-use equipment, results are actively monitored, preventing chronic illness from escalating and giving people reassurance that their health is under control. In combination with analysis being used at point of care, further savings can be made and in fact save lives.
When your veins are shot from chemotherapy, it's a nightmare. So this has been, like they've said, a lifesaver. Yeah. Because you don't start to freak out thinking, oh, I've got to have another blood test and they're not going to get it. And when they have 4 or 5 goes, which used to happen more in Adelaide than in the Riverland, you just don't want to have it done anymore.
The simplicity of this model has been completely tested to ensure quality assurance, ease of use and value being delivered where it is needed most. And people start taking more accountability for their own health. They want to do well with the testing and are supported with any slip-ups to get back on track.
Because as soon as my blood pressure went up, I'd get a phone call saying, oh, what have you done differently today? So yes, very well supported.
And ultimately, this scalable approach has a proven impact that is easy to replicate across remote areas.
So it's keeping them out of the medical centre, keeping them out of hospital, and we are seeing them here earlier. So I think it's great.